In 2014, the Commonwealth Fund ranked the United States last in overall health care, behind the United Kingdom, Switzerland, Sweden, Australia, Germany, Netherlands, New Zealand, France, and Canada. Everyone will need help with their health care in their life, and it can be very costly and even more concerning. If you've been watching any of the presidential debates, races, or town halls, then you may have seen or heard about the issue of universal health care. I believe we should all have the ability to see a doctor when we need to. If everyone could have access to healthcare, then we would be a healthier, wealthier, and more enlightened society. With growing rates of obesity, a lot of Americans are having medical issues, especially the ones without insurance. If everyone could have access to a doctor, then we could be better educated on how to make healthy living life choices. If you are sick and don't have any insurance, you may decide to skip on an expensive doctor's visit. I found myself in a quandary last time I was sick. I didn't want to spend $400 to see a doctor without insurance. I feared I had a viral infection and there would be nothing a doctor could do anyway. Sometimes we are sick because of a major medical issue, not just the flu or a bad cough. After I ended up going to see a doctor, I got a chest x-ray showing what I thought was cancer at first glance. If we could see our doctors more frequently and have regular health checkups, they could track our health easier. Doctors could help educate their patients with information on how they can live healthier lives. This means people would think more about healthy choices and improving their overall health. With people making better life choices, we would be healthier as a group. That also means we could save money because we would not have as many medical emergencies or urgent care visits due to poor life choices. For a healthy 30-year-old non-smoker, health insurance is well over $200 per month. At least that is what my health insurance would cost. Now with government regulation, health insurance providers can charge whatever they need to turn a profit. Companies are overly concerned with their bottom line. The United States spends more on healthcare per capita than any other UN member nation. By removing profit as a motive, drug companies are more likely to consider what drugs would benefit most people and less about which ones would create the most amount of profit. The United States spent over $8,500 per person on healthcare in 2011. That's more than 2.5 times the average spent by member countries of the Organization for Economic Cooperation and Development, which spends just over $3,300 per person. We are already spending more than other countries on healthcare. We should be making sure that money is going towards our individual healthcare and not the billion-dollar pharmaceutical and insurance companies for profit. The more money in our pockets and the healthier choices in our minds, we can change our culture. Almost 35 35% of the adults in the United States are obese. The medical related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancer. Some of the leading causes of preventable death, the estimated annual cost for people who are obese were $1,429 higher than those of normal body weight, according to the Center of Disease Control and Prevention. Having a healthier diet and regular physical activity will have a major imprint on long-term health benefits and prevention of diseases like type 2 diabetes and heart disease. People who are obese are at increased risk of many serious diseases and health conditions, including all causes of death, coronary heart disease, strokes, gallbladder disease, sleep apnea and breathing problems, some cancers including breast, colon, kidney, and liver, low quality life, mental illnesses such as depression and anxiety, body pains, and difficult with physical functions. If we were more educated on health care, we would make better choices and limit diseases caused by obesity. With health care for everyone, we could lead a healthier, wealthier, and more enlightened life. I got my information from the Center of Disease Control Prevention, procon.org, and debatewise.org, the page America Should Have Universal Health Care. With tighter stomachs, healthier hearts, and thicker wallets, we would all benefit from universal health care. We're having a more enlightened, less expensive relationship with our doctors. We can extend our lives by making healthier life choices and cutting obesity-related diseases and illnesses. After going to urgent care with the flu, I found out I have a lung granuloma that will need constant vision and care throughout my life. I wish I had health care at a younger age because this is something that has affected me my whole life and I didn't even know it was there until I had no choice but to pay up and go to urgent care because of the common chest cold. With that in mind, universal health care would be something we can all benefit from as a society and a group, where we could live longer, healthier lives and make more money in the process. It's something that we could all benefit from and we should have by this time in the United States. Thank you for listening to my speech on universal health care.
That was good.